Hello everyone, I'm Dr. Aruna Kalra. I'm Director Obstetrics and Gynae Department at CK Birla Hospital. So the topic which is given to me is a really nice topic. It is sexual health of everyone, I must say. Not only women, men, kids, adolescent kids, everybody needs to know about sexual health, and which, talking about which is taboo in our society, in our country, and I would say where we practice, it is NCR, it is metropolitan city, where I get all educated class people who are well read, well informed, Google savvy. Still, I would say that it's very few percentage of girls and boys and couples when I meet have any good information about uh, anything related to sexual health, being it contraception, emergency contraception, sexually transmitted disease, adult vaccination, how to prevent unplanned pregnancy, or what are the best practices to avoid pregnancy, or to, for that matter, orgasm for female, or how to react if our kid starts sexual activity early in their childhood, or how to handle adolescents who's falling into excessive sexual activity or a normal sexual behavior. Sexual health is related to our emotional well-being, mental health, our social health, social structure, and our health as general health, physical health also. If we say that sexual activity starts as early as 5 or 6 years of age, a kid who is just 6 years old knows that what are her genital organ or his genital organ, and they start stimulating those organs, which is, they feel good about it, they also feel orgasm about it, and that's when a mother gets disturbed while my kid is having this kind of awkward gesture in front of relatives or in public. We should understand that this is absolutely normal, but what we need to make them understand, first we as a parent should be comfortable with. So we should know that a child who's 5 or 6 or 7 years of age can have these kind of touching their genitals when they feel, and they feel good about it. But we have to make them understand that it is something which is secret, and we should be doing in our private homes, or in our private rooms, in our privacy, and it is not to be done publicly. But we should not shame them. We should not scold them for what they are doing, and we should not tell them that it's wrong, because as soon as they grow up, they understand that what should be done publicly and what should not be done publicly. So as soon as young as 5 or 6 year old kid would have sexual behavior, when they grow up, and if there is some abnormality, like if they are constantly obsessed for like they touch their genitals constantly and in public, we should show to psychotherapist or pediatric psychotherapist that it's whether they are going through some kind of stress, whether there is some like parents are not attentive, they are not giving enough time, kids are getting bullied at their school or somewhere else, or kid is getting sexually abused by someone. So if it is excessive, it is obsessive, we should go to pediatrician, we should go to pediatric psychologist to get this checked. But it is a normal behavior. Same way, as kids grow a little younger, they are in their adolescent, they reach puberty, they have change in their physical features. A girl starts developing breast and a figure which is narrower on waist, and their hips gets enlarged, breast gets enlarged. So they get to know that they are getting sexually attractive, and same with their hormones are changing. Boys are at puberty, their genitals are growing, they are getting bigger muscles, shoulders grow broader, and again hormones are changing, and masturbation is absolutely normal at that age. Again, the myths associated with or around masturbation is, and we have seen our grandparents and our previous generation saying that okay, you would develop all pimply face, or you would go insane, or all these things are very very wrong. So these are all myths. We should not actually misguide them or threaten them that this is wrong. This is absolutely normal hormonal behavior. They are not going to go blind or develop warts or so on and so forth. Myths are there. We should tell them that okay, it's absolutely normal, and you should do again in their rooms, in their privacy, and do not ever try to tell them that it is absolutely wrong. That would actually undermine their confidence. They are exploring their sexuality, they're exploring their youth. So if there is some abnormal behavior which is again obsessive compulsive, or which is related to their mental health, they are not studying properly, they are lagging behind in school, only then we should seek psychologists opinion. Otherwise they are absolutely normal activities in growing adults and adolescent. And now we have crossed our teens, we are in our 20s, 25, 30s, and we know that we are independent. We are now either in college or we are earning, and in this era, and we know that we are exploring our we are exploring that we can have boyfriend, we can live with it, we can have girlfriend. So live-in relationship and sexual activity before wedlock is really common nowadays. And again, we are not, this is absolutely normal, this is a norm nowadays, we should accept it. Only thing what we need to teach them is safer sexual activities, safer methods of contraception, what safer activity, and it should be accessible to them, it should be affordable to them. They should understand that if they would, and if they are not available there to discuss, they would definitely fall for wrong sexual activities. They would fall for no contraception, unplanned pregnancies, sexually transmitted diseases, cancers, or so many things, infertility in future. So these are the side effects when we do not talk about safe sexual health practices. So we should understand that now we are in our 20s and we need to have sex, and this is the one of the need of a body, and we are not going to get married at the age of 20 or 22, what was the norm previous years. So as soon as a girl turned 18 or boy turned 20, 22, they used to get married, and that is how they fulfilled their sexual desires. But now we are getting married at around 30 or beyond, and you cannot ask for abstinence from every young boy and girl that okay, sexual activity is totally abandoned before marriage, and you should be totally safe if you are not going to have sexual activity. That is abstinence. This is very very impractical to ask for. So let's now teach them or tell everybody that what are the safe sexual practices, and why are we teaching them that this thing, because we want them to be safe for their future fertility. They should not develop cancer, which is cancer of the mouth of the uterus, cervical cancer, which is infertility, infection of tubes. In boys, it can cause penile cancer or oral cancer. So today we are going to discuss how to prevent this one by one. Let's start with contraception. All these things which I'm going to tell you today, I'm getting patients every day, and I must tell you that I teach each and everyone all these points, and these are very precious teachings, I would say. So contraception, first myth related to contraception is that every contraception is wrong. Every contraception has side effects. So if I talk about that, okay, condom you're using, which would prevent you from sexually transmitted diseases. You would not develop gonorrhea, chlamydia, HPV infection, and many more infections. People would say that, yes, definitely we know that condom would prevent us from sexually transmitted diseases, but it does not give me pleasure and my partner does not want to use it. And I would say for sure, and it has 10 to 17 per 100 couple per year failure rate. So failure means that if 100 couples are using, 10 to 17 might get pregnant, okay, even after using condom. So what to do? See, condom has to be used to prevent sexually transmitted diseases if you are not with single partner, or if your partner is not with single partner. One thing. Second thing, because there is a 10 to 17 per 100 couple failure rate, why don't we add spermicidal jelly to it and make it a little less like it more safe, and failure rate would be less. But I asked, and the patient would say that I asked that I do not even want to use condom because it does not give me pleasure. So my answer to her would be that if you have single partner, please enjoy without condom. I'm not worried about sexually transmitted diseases, so you should not be worried. But any other concrete contraception which would prevent you from pregnancy at least. So coitus interruptus has more failure rate. People who are discharging outside immediately is not a very safe method. So every safe method of contraception should be 100% effective and 100% reversible. 100% effective in preventing pregnancy, 100% reversible in preserving our fertility. But sexually transmitted diseases can only be prevented by condom or diaphragm used by female. So if you have a single partner and you want another contraception method, contraceptive pills would be the best contraception method. Contraceptive pills to be taken daily for 21 days, give a gap of 7 days for periods and start another pack again. So this is one thing which is going to give us 100% protection. People sometimes do not want to use oral contraceptive pills because it gives them some side effects. Side effect can be nausea, it can be a little bloated feeling, breast tenderness. Okay, we understand that. So we have another method for you, which is vaginal ring, which has those medicines which are in OC pills. You can insert vaginal ring on 5th day of your periods. Let it be there. Let it be there inside the vagina for 21 days. Remove it after 21 days. Give a gap of 7 days for periods to come, and you reinsert another ring. So it is exactly same as oral contraceptive pills, but you don't have to remember every day taking pill, and it would not give you systemic side effects like nausea, or sometimes if you are wearing contact lenses, it sometimes causes irritation in your eyes. So use Novaring, that is also absolutely right. And if you have had a baby and you want some other contraceptive method, there is intrauterine device, Mirena intrauterine copper device. Again, people would come and say that somebody in their family used and it went up, or they had infection, or they had very heavy bleeding, or innumerable side effects. I would say साइड इफेक्ट्स आर देयर ऑफ एवरीथिंग. हर एक चीज का साइड इफेक्ट है. आप सड़क पर चलेंगे तो उसका भी है, आपने कुछ खाया तो उसका भी है, पैरासिटामोल का भी तो फिर साइड इफेक्ट है. तो क्या हम नहीं लेते हैं? अगर साइड इफेक्ट्स हमें होंगे तो हम छोड़ देंगे. नथिंग इज परमानेंट. आप यूज करिए, आपको नहीं सूट करता आप छोड़ दीजिए, आपके लिए हम दूसरा मेथड लेंगे. हम लोग आपको कॉन्ट्रासेप्टिव इसलिए ऑफर करते हैं कि आप सेफ रहें अनवांटेड प्रेगनेंसी से, और अगर इन्फेक्शन होते हैं तो उनसे. मगर अगर आप हर एक चीज को आउटराइटली रिजेक्ट करते जाएंगे तो बहुत मुश्किल है. इससे ये हमने सुना, उससे वो, और ऐसे पेशेंट्स आते हैं who are not able to accept any kind of contraception, which is very wrong. So contraception is important. One more important or most important thing is emergency contraceptive pills. People take emergency contraceptive pill or morning pill like peanuts. Every time they have sex, they would take emergency contraceptive pill. A young couple who is having daily sex, they would take every day or every alternate day or morning after pill, which is a very high dose of progesterone. You are not supposed to take inadvertent high doses of progesterone just like that. And this is morning after pill is emergency contraceptive pill. When you are using some other method and it failed, like if you used condom, it got slipped, it got torn, only then you have to use. Again, you must know that it should be taken as early as possible. If you took emergency contraceptive pill around your ovulation time, chances that you will conceive and that conception might not come inside the uterine cavity, it would get stuck to you, because emergency contraceptive pill makes uterine environment hostile. It would not let your pregnancy come or baby come inside the uterine cavity. But pregnancy already has happened because you were in your ovulatory days, and it would get stuck to tube, which is called ectopic pregnancy. And once ectopic pregnancy has happened, that tube is gone. You have only 2 fallopian tubes. You cannot risk that. So please stop taking morning after pills. The OC pills are much safer than morning after pills. So first and foremost lesson to every young adolescent, every young couple who are indecisive of right now of going to family way, my suggestion would be, please use some complete contraceptive method to retain your fertility. Because if you develop infections, if you develop ectopic, your chances of fertility would go down month after month. So contraception is one thing, and it should be accessible. You should have proper knowledge of it. We are here to impart. Second is adult vaccination. And why are we talking about adult vaccination? Because this vaccination against human papilloma virus, which is called HPV, has come, and we have started giving our young kids around 11 or 12 years of age, boys as well as girls. And why I pressed a little more on boys, because people think that HPV virus vaccine is for cervical cancer. Yes, sure, it is for cervical cancer, because cause of cervical cancer 90% of the time is HPV virus infection. So 90% of cervical cancer or cancer of the mouth of the uterus is caused by HPV virus, and which we can prevent by giving vaccination to a girl who is 11. So less than 15 years of girl or boy would be getting only 2 doses of vaccine, one and then after 6 months. But if you have grown more than 15, you would be getting 3 doses, one after 2 months is second, and after 6 months is third vaccine. But if you're 35 already and you have never received HPV, you can get HPV vaccine till the age of 45. So HPV virus vaccine can be given to a girl who is still not reached 45. As soon as somebody gets sexually active, we ask them to go for pap smear test regularly, yearly, after 3 consecutive normal pap smears year after year. Once you have got your HPV virus vaccine, you can go after every 3rd year also. So that's absolutely mandatory test for everyone, not related to anything else. Like every female should get pap smear done. Now you got your HPV virus vaccine, your chances of getting cervical cancer are less. You can go after every 3 years for pap smear. So that is one thing. And boys also are going to get, because HPV is a virus which, as it can affect a female, can also affect a male through sexual intercourse. So oral and penile cancer can be prevented, and very ugly growth which we have seen many times, warts, girls get and boys also get perennial warts, and those are really ugly, not painful but ugly. They would not like to, nobody would want. So those warts also can be prevented by HPV virus vaccine. So adult vaccine, first thing is HPV virus vaccine. Other vaccines, yes, there are, like you should know your hepatitis B status, vaccine status, MMR, rubella status. So all these, and typhoid and influenza, these are all adult vaccinations. So you should know about all those things. Is the second thing. coming back to sexual health. So another thing which we are worried is sexually transmitted diseases. Sexually transmitted diseases, people can present with many symptoms. And one and very most common symptom is itching, perineal itching, vaginal discharge, constant discharge, sometimes dry, flaky discharge, sometimes watery discharge, a very low nagging lower abdominal pain, backache, or sometimes repeated urinary tract infections. So all these symptoms are symptoms of sexually or vaginal infection, and for men also it is repeated urinary tract infection. Sometimes you will get vesicles, sometimes lesions around your penis or scrotum, and warts, as I said. So all these things, you might be suffering from gonorrhea, from chlamydia, from HPV virus. We should always, if we have a partner, and again we have a new partner, not at the same time you should be having multiple sexual partner, but if you are having if you are exploring that, okay, who's the good partner for me, and you have repeated one after the other, that's absolutely okay, but get yourself checked for hepatitis B, hepatitis C, HIV, HPV. All these are sexually transmitted diseases. And go for pap smear, and for men, if they are having some kind of symptoms, go get yourself checked for gonorrhea and chlamydia. Gonorrhea and chlamydia are very serious infections which can cause infection of uterus. It can ascend up to your tubes. It can cause permanent damage to your tubes. And if we are seeing nowadays girls with total blockage of tube without any reason. In our previous practice, we whenever we thought that, okay, there would be tubal blockage, we used to find out whether they had some surgery, whether there is some history of tuberculosis in family. But nowadays, we don't have to search for anything. And just like that, people are having tubal blockage, and then we get to the history that they were having sexual partner. They never went for gonorrhea or chlamydia treatment for themselves. So see, again, taboo, myths, everything is associated with it, and we do not actually approach our parents. And a gynecologist visit is definitely, I don't think we could do very less.
Absolutely. There are so many myths around this and so many misconceptions, and there is this sense of shame that even if there is discomfort, there is symptoms presenting themselves as an itch or as a discharge, people want to do home remedies. They don't want to go to a doctor. There is a sense of that I will be judged for being sexually active or for having multiple partners. But then at the end of this, I think it boils down to a lack of information, which is there. A question that has come from an anonymous attendee, and this really reflects in what we were mentioning, the myths attached to sexual health. Are regular orgasms, can they be harmful, is the question.
Yeah. So I would say that yes, I get female patients who, there are two types of patients. One is a female who wants to have sex at whatever age. Like we never discussed that. Like there is a topic for menopausal sex. Okay, people who are menopausing, perimenopause. There are two types of problems. One is they are totally not interested, another is they are really interested. And sometimes if a girl is really interested and she was not given that importance to her sexual pleasure, her sexual desire, that is also very bad. And females, they think that orgasm should not happen, or sometimes they feel guilty about having that pleasures. They cannot ask their partner that they never have orgasm. So I think as we know that intimacy, hugging or touching or having sexual love making, I should say, it gives us endorphins, the oxytocin, and it is really relaxing and important for everyone. So why are we getting stressful environment nowadays? Because people are not indulging so much in love making than in sex. Okay, sex is like, okay, target oriented. We want to have baby, and these are the days and we should be doing. And both of them are stressed. Female is stressed anyway. She's a passive partner, male is stressed, not getting erection, and all those things. So it is now it has lost its love making thing. Nobody's, and the sexual abuse, sexual violence, like people who are uneducated, coming from not very educated family, they are not giving their pleasure by getting orgasm or so, and females themselves also feel guilty. So many things are associated around orgasm, that whether we should get or not, whether we should ask or not, and female gets multiple orgasm after one this thing, sexual activity or love making. Men gets only one, so which is absolutely good and normal.
But I think the thing is that don't be afraid of it. Having the regular orgasms, I guess, is a good thing. You're lucky if you're getting regular orgasms. Don't be afraid, it's not harmful. The similar sort of concern comes around masturbation, Dr. Kalra, that there is a link to impotency, there is link to that if you overdo it, it's not good for you. Can you talk a little bit about that? And also specifically to females, because usually masturbation is associated with young boys, but there is something called female masturbation as well. And if you could talk a little bit about it.
Yeah, so same way as boys, we always thought that it is only boys thing, masturbation. No, females also do masturbation. They also need to have orgasm or that sexual well-being feeling within themselves. And whether it's boys or girls, having orgasm does not cause any harm to your physical health. It will not lead to infertility, it will not lead to impotency or any kind of infertility in future. The only thing is that orgasm is one thing, and masturbation is repeated masturbation, how much ever you want to do. But it should not be obsessive, as I told, for kids, for adolescent, for an adult. So any activity which you indulge normal with normal frequency, it's normal. But when you are indulging it everywhere, like if you're in office or it has become an obsession for you, then we have to link it with some kind of, whether you are going through stress, whether you're going through some bullying, whether you are not having partner or family or somebody around to talk about things. So all these things are also, like whether you are in abusive relationship or so some kind of psychological trauma, whether you are going through, and that is why you are just satisfying yourself with masturbation. So all those things also should be seen. But normal, regular masturbation is absolutely normal, and you are not going to get any physical illness through it.
Right. Dr. Kalra, also there is a lot of concern about portrayal of and the sort of pressure that is on the female reproductive or the private parts, because there are now products in the market that say that they can whiten, they can make them smell different, and so there is a lot of pressure, especially on young girls, to a degree that they start harming their private area. What should female private area look like? Because in normal and not on TV and not on media, there are shades, it is dark, it is hairy, it smells different. So what should a good and healthy female genital area be like?
Okay, so yes, definitely it is understandable, because when we get patients to tighten their vagina, to again make a hymenoplasty and all, so we get to understand that how important or how stressful it has become nowadays. Again, so I should tell you one important thing here, that people using talc, powders, perfumes, or perfumed creams or lotions should absolutely be banned. It should be prohibited, because you should know that talc can cause ovarian cancer. Perfumes and all other products are really harmful for your skin. It can cause skin allergies and skin early cancers. Okay, so I'm not saying cancer, because everybody would be afraid, like, oh my god, everything is golden cancer. So yes, lichen planus and all skin diseases which are uh, preliminary, like in spectrum to cancer. So you can develop those illnesses of skin, which is a really painful hypopigmented diseases. So one thing is that because it would cause you physical harm, or it would actually give you ailment or disease in future. So that you're not going to use perfumed creams or perfumed lotions. You're not going to use vaginal washes, which people are using every day after every pee. I just do not understand. So vaginal washes, they alter your vaginal pH. Vaginal pH is acidic for some reason, because it prevents, there is a bacteria which prevents all other abnormal bacteria to grow or fungus to grow inside the vagina. But repeated cleansing of vagina by vaginal washes or by douching kills that bacteria. It kills that bacteria, and there is no bacteria to prevent us. If I ask you to clean or wash your eyes 10 times a day, your eyes would hurt. So you would not have any tears to protect. If I ask you to rinse your mouth after every 10 or 15 minutes or after every 1 hour, would you do that? Your mucus glands or mucus has so many enzymes and everything, and protective bacteria. Your gut has protective bacteria. We take Enterogermina and we take so many probiotics. You take Yakult and so many things to protect your bacteria, your intestinal bacteria. But why are you killing your vaginal bacteria? You and everybody is getting infection, candidal infection and all other infection just because they are killing their protective bacteria. They are killing their guards in vagina. So please do not use vaginal washes after, like, morning soapy water bath is enough. You don't have to clean your genitals repeatedly. And after peeing and pooping, just clean with normal water. That is enough. You don't have to unnecessarily use vaginal washes. If they smell, if it is smells, it is absolutely normal. It is normal to have hormonal smell. Every age has a different smell. Your sweat has a smell. So it does not mean that it is bad. And if somebody has to love you, it will love, that person would love you anyways. So your perineal area, you have hair growth, and if you go for unhygienic bikini or so you would be getting folliculitis, which is hair follicle infection. Those in the hair follicle would develop abscess or pus or all those acne around there. Those are painful, and those starts happening repeatedly. If there is one hair follicle infected, you would get repeated folliculitis. There is one thing. Second thing is it is a little dark area. It is hyperpigmented area. There is like labia minora, labia majora. Labia majora is fleshy. Labia minora is thin, and it is in the skin, mucosa inside. If you spread your labia minora, so minora is inside, majora is outside. So vulval lips, there are two vulval lips on each side. When you spread, you would see vaginal mucosa, which is pink in color, and it has rugosity. So it is like a ragged kind of appearance. So this is absolutely normal, and you would be having normal vaginal discharge, lubrication. Vagina is not dry, but if you check in mid-cycle, like on 12th, 14th or 16th day, you will be having a little extra cervical discharge, which would be watery discharge. Again, there is a peculiar smell on every vaginal discharge, but only abnormal discharges would be if it is excessive watery throughout the month, if it is itchy, if it is flaky, curdy, white, if it has greenish hue, or anything which smells like fishy egg, or it is really itchy, or it is that watery that you have to change your panty twice or thrice a day, or if it is thick and curdy and white and it is like you have to remove and it itches a lot. So all these characteristics are of abnormal vaginal discharge. Otherwise, please do not douche. Please do not use vaginal washes.
Right. How to prevent labial or Bartholin cyst?
The Bartholin cyst is Bartholin gland. We have two Bartholin glands in both labia. Okay, so once and gland has mouth, which is have you? अगर आपने कभी घड़ा देखा हो, उसका मुंह ऊपर होता है. So it is like that, a pitcher which has the mouth up and the reservoir down. once this is infected, the reservoir starts getting pus inside it, okay? And there is no way we can correct it without removing that gland, because that gland is now filled with pus, okay? And mouth is above, like a pitcher. So it cannot come out of that mouth. We have to make it upside down, which we cannot do. It is attached to our body. So we have to give a nick down, okay, in the reservoir. घड़े को नीचे से तोड़ना पड़ेगा. लेकिन जब भी उसको काटते हैं वो फिर से चिपक के फिर से पस बनना शुरू हो जाता है. तो ग्लैंड तो खत्म हो गई, उसका काम खत्म, because once it is pus is formed in it, it has no function. So we have to remove the gland, otherwise it will repeatedly form in the same place. Now question was how to prevent Bartholin abscess or cyst formation. So because it is infected, as I told you, if you are getting your bikini wax or you yourself are doing or whatever, those hair follicles, those kind of infection causes infection of every gland over there. And if you have, if anybody is having repeated follicular abscesses, abscess on your bum, abscess on your leg or on your perineal area, and it is repeatedly happening, you should know that you are a carrier of Staph aureus, which is a bacteria which you carry in your nose. So you have to first break the cycle of Staph aureus carrier state, and only then you will be recovered from repeated follicular abscesses. So one is this, that okay, we know what is the reason. We have to clear Staph aureus from our blood by going to doctor. But using repeated vaginal washes, again, it actually kills your protective flora, and you are prone. If you are going to common toilet, you should be using P-Buddy, which is stand and pee device. So if you will not sit on commode, that would be a preferred thing to do. And do not cleanse, like as I said, regularly. And mostly if you are using condom, if you have a partner who you're not single partner, that also prevents Bartholin. But Bartholin mostly develops when you have low immunity, you take repeated antibiotic courses, and your hemoglobin is really low, your sugar is high, or you're using common toilet very frequently, or they are going for bikini wax on different partners and getting infected.
So Dr. Kalra, it's almost time for us to wrap up, and it was a very, very insightful session. Just before हम लोग इसको wrap up करें, एक सवाल मैं पूछना चाहूँगी, और बहुत से लोग, I think a lot of females feel this, कि जो हमारी गायनोकोलॉजिस्ट होती हैं बहुत जजमेंटल होती हैं हमसे बहुत सवाल पूछती हैं और फिर जजमेंट भी करती हैं. तो how do you, because you are somebody who's very open and it was very easy to talk to you, so why are gynecologists so judgmental, and how can we break the ice?
Okay, so I would say I see the thing is here. I'll just tell you a story in very quick few words. That once we started our practice way back 2000. So that point of time when somebody came with unwanted or like unwanted pregnancy from out of wedlock, she was 22 or something, and then we would, oh my God, ये कैसे हो गया, किससे हो गया, कौन था? हम लोग बिल्कुल इंटरेस्टेड नहीं होते थे कि वो क्या what she is going through, or she is pregnant and she wants to get rid of this. हमारा ये होता था कि by God, इस लड़की के साथ किसने क्या कर दिया, चाहे वो लड़की खुद के बॉयफ्रेंड से ही मजे हुए हैं, everything is good, happy, and now she is pregnant and our focus is कि उस लड़के को लाओ, उसको पीटो, इस लड़की को समझाओ, ये हमारी moral duty हो जाती है. मगर with time everybody has to change. See, today if I have a young daughter who's in college, I would not tell her not to have sex and all those things. I know that she is going to have. I'm not going to get to know when she's going to have sex. So I have to tell, see, you have to use condom. I am giving you oral contraceptives. Please use those. And if you ever get pregnant, come back to me. I'll do safe abortion. Please do not worry about that. So you should be open to that. Okay, so it's just that as social fabric is changing, we have to change our mindsets. Okay, you cannot be in the same thing कि okay किसने कर दिया क्या, उसको पकड़ो. So moral duty आपकी सिखाना है उनको safe practices. as I started, abstinence is not the way. Abstinence is, you're not going to preach abstinence. This is absolutely normal desire to have sex or love making at that age. We are not going to marry them at 18 or 20. So we cannot ask them not to have sex. So that is why it is important that we should we should be supportive to our younger adults, whether it's boy or girl. And once we are open, they would come up with many questions like, okay, and every day we get these, okay, they thank me and they say कि क्या हम एक और क्वेश्चन पूछ लें, हमारे दिमाग में ये भी था. और जब तक आप जजमेंटल रहेंगे, जब तक आप उनको गलत नजर से देखेंगे, वो पूछ ही नहीं पाएंगे जो एक्चुअली वो कहीं से भी नहीं पूछ पा रहे. वो अपने पेरेंट्स से नहीं पूछ पा रहे, अपने सिस्टर से नहीं पूछ पा रहे, किसी से नहीं पूछ पा रहे. आज आपके पास आए हैं, आप भी जजमेंटल हो गई, आप भी मॉरल पॉलिसिंग कर रही हैं, तो फिर कहाँ से सीखेंगे? फिर कौन बताएगा कि पैप स्मेयर कराना है? फिर कौन बताएगा कि HPV वैक्सीन कराना है? फिर कौन बताएगा कि मॉर्निंग आफ्टर पिल नहीं लेनी है या कॉन्ट्रासेप्शन लेना है? या कौन, ये सारी चीजें कौन बताएगा? फिर तो बढ़ेंगे ही ना, हमारे इनफर्टिलिटी के केसेस भी बढ़ेंगे, सेक्सुअल ट्रांसमिटेड डिजीजेज भी बढ़ेंगे, अनप्लान्ड प्रेगनेंसी और एक्टोपिक प्रेगनेंसी भी बढ़ेंगे. सिखाने वाले भी तो हम हैं ना. वी शुड बी ओपन टू दैट. सो दैट इज द ओनली थिंग, दैट everybody should be open that sexual health is very, very important. Like very freely accessible, affordable sexual health should be given.
Absolutely, very rightly said, Dr. Kalra. Because मुझे लगता है कि जब आप अपनी sexual health के बारे में, when you empower yourself with the right information, then you can take other calls of your life. You know, like you're saying that it is important for women to understand consent in a sexual relationship. That is not coming in. This conversation, even between couples, you know, what I want, what you want, you know, so that it is a pleasurable experience for both. This will happen, I think, when we take charge of our sexual health. And this today was a step in that direction. Dr. Kalra, thank you so much for spending this time with us.